Hey, good afternoon, everyone. It's great to be back with you. I'm Dr. Michael Hirsch from the Division of Public Health and the Chief Pandemic Public Information Officer for the City of Worcester during this pandemic time. And I haven't spoken to you all in a little bit. We've been busy, as you can imagine. This time where we switched over from defense against this terrible virus to offense, where we had to administer thousands of vaccinations and provide a lot of support for various organizations, industries, retailers, and families in the city. It's taken a little while for me to get back to talk to you, but here I am, and I wanted to give you an update about how the pandemic is going, where I see it going, how I believe you can help us get the best outcome for yourself, your family, and for this city that we love, right? So where we have come from is a sad tale because, March 10th of 2020, a national emergency was declared, and the World Health Organization followed suit and declared a World Health emergency the next day. And so it's been a little more than a year and 6 weeks since that time. And in that time, we spent about 9 months on defense, just trying to support one another, getting people tested. That was our biggest ability to kind of contain the spread of the COVID-19 virus. And then once we test and found a positive patient, we found that we had to do extensive contact tracing to see where that person had interfaced with other family members, with friends, with people at work, with people that were customers in their stores or passengers on their buses, or students in their schools. So all of this work went into the first 9 months of the pandemic, and it's still going on. The testing is very important, and at the Mercantile Center, through the good grace of the state government and also some federal monies, we've been able to do the Stop the Spread testing at the Mercantile Center at least 3 days a week. No prior sign-up is needed. You just walk in, and the process is pretty smooth. And then the good news happened in December. The Food and Drug Administration approved the Pfizer virus, followed by the Moderna virus, and then about 3 months later, they approved the Johnson & Johnson vaccine. So all three of these vaccines had very good marks for efficiency of keeping you from getting COVID. Moderna and Pfizer's vaccine was 95% effective in keeping you from getting COVID. Johnson & Johnson was a little less effective. It was 72% effective, but it was tested at a time when the variants, and you'll hear me talk about that in a minute, the variants were around in Europe when Johnson & Johnson did their tests. And I suspect that if the other two vaccines had been tested in those situations, they might have had a little lower grade too. But 72% is a very effective vaccine. And in addition, 86% of the people that were getting Johnson & Johnson didn't get serious cases, and 99% didn't end up in the hospital. And the advantage of Johnson & Johnson, as many of you know, is that Johnson & Johnson is a one-shot vaccination, whereas Moderna and Pfizer both needed a booster about 3 weeks away in Pfizer's case and 4 weeks apart in Moderna's case. That made it a little more complicated to give Moderna and Pfizer compared to Johnson & Johnson, and we were very excited about Johnson & Johnson's arrival on the scene in end of March. Now, I'll come back to Johnson & Johnson in a minute. through the efforts of the city manager, the Department of Public Health was able to unite with the emergency management section of the cabinet to stand up the senior center, where so many of you got so much of your support, your recreation, your sense of community. So I want to say thank you to all the listeners who are from the senior center for lending us your home. We stood that place up on January 11th, and from January 11th until March 30th, we cranked out thousands of vaccinations there. We started as per the governor's script. He gave us the people that needed to be prioritized. So first we did first responders. That was fire, police, EMTs, paramedics, certain types of home health aides and visiting nurses, all the providers that were really front-facing to patients that might have COVID. That was the first cohort we did, and overall we were about 80% effective in getting that group vaccinated. Then we were allowed to do the seniors 75 and up, and following that 65 and up. And we've achieved about 70% vaccination in that group, which is very close to herd immunity. Most people say that herd immunity, meaning so many people are vaccinated that the virus has no place to go and can't really spread anymore. Most people say that it should be at about 75 to 85% of the community in order to get herd immunity. And the reason we feel we don't have to get 100% is, unfortunate, we know that close to 30,000 people here in Worcester have had the virus. They caught the virus, and that gives them some immunity. So we can add those people into the numbers of people that we think will at least have some immunity. So we came a long way with that process. But sometime in the middle of March, the governor decided that there were 20 municipalities in the Commonwealth that really had a problem with health equity. And you are probably familiar with that term. That means that not everybody has equal access or better or equal outcomes to the COVID-19 virus. We wanted to try with the vaccination process to reach out to the communities that suffered the worst in the first surge, which was in April of last year, 2020, and the second surge, which happened from November to January in 2021. And it was the Black population, the Latinx population. They were the people that were the next group. After the elders, after the folks that were 65 and up, they were hit the hardest, the elders. After that, it was the community of color. And so that's the group that the governor wanted the city of Worcester to concentrate on. So they call that process equity dosing. So Dr. Matty Castile, who is our Health and Human Services Commissioner, and a wonderful person, so dedicated to folks that are homeless, folks that have substance use disorder and are addicted, and to all the underserved, started a process of giving out vaccinations in these troubled community center areas, parishes that were in the communities of color, housing that was federally or state funded or city funded housing in these troubled areas. Now, how did we get all of this done? Because thousands and thousands of doses have been given out. Well, my small part in this was that just about a year ago, I called a dear friend of mine, a professor of nursing at UMass Medical School, and said, we need to crank up our old system of teaching the medical students how to give injections. Because believe it or not, doctors don't get trained to do that. Nurses do, and with the Graduate School of Nursing where Professor Terrian taught, we had done once before a flu-related training for the medical students so they could go into the Worcester Public Schools and get more kids vaccinated. So we cranked up that model again, and we, from the time that we first spoke last April until January 11th, when we actually started putting needles in arms, we trained up about 650 medical personnel at the medical center. Also, we were able to get the Worcester District Medical Society, which is our local organized medical society, to recruit for us a whole bunch of retired physicians and nurses who could renew their license easier because Governor Baker told the Board of Registration of Medicine he would not be against having some of the retired physicians just specifically renew their licenses just for this purpose. So in the end, we had a vaccination army, a vaccination corps, we call it, of about 800 people. And so when we were doing our vaccinations up at the senior center, or Dr. Castile was doing her equity dose vaccinations out in the field, we had a huge pool of volunteers. Now in the meantime, because the size and scope of what we could do at the senior center was somewhat limited, the city manager brokered a partnership between the Worcester State University with President Maloney, Carolyn Jackson, who is the CEO of St. Vincent's Hospital, and Lisa Colombo, who's the head of Commonwealth Medicine, which is like a public health arm of the medical school at UMass. And the three partners then stood up a mega site for much more volume, high volume administration of the vaccines at Worcester State University. So they are cranking out every day somewhere between 2,000 and 3,000 vaccinations. And that's how, as we sit here today, now we're kind of in the middle of April, we have about 30% of our population completely vaccinated here in Worcester, and about 48% at least having one of the two doses of the two-dose type of vaccine. Now let me circle back a little bit to the Johnson & Johnson situation. Many of you know that we were giving out Johnson & Johnson with great glee because it was a one-shot dose. So if you were really struggling to get someone to come in to the vaccination centers, giving them just one shot was a real relief to all of us. We didn't have to track them down for the second dose, and they didn't have to worry about coming in again. So about 7 million doses of Johnson & Johnson were administered all over the country. But then it was reported out a couple of weeks ago that 6 young women between the ages of 15 and 48 had very unusual blood clotting problems from that Johnson & Johnson dose. One was fatal, and one ended up also in the intensive care unit. These are very, very good odds that Johnson & Johnson is safe, right? It's less than 1 in a million chance that you would get this problem. But we have a very, very thorough Food and Drug Administration and Center for Disease Control, the CDC, and they weren't going to let any more doses go out until they had studied what happened to these 6 individuals who had had this type of clotting problem. So we're waiting on their decision. I think it's going to be this week that they have pressed the pause button, and then they're going to release that pause button, because I just don't think there's enough evidence that this is a widespread problem that's going to be much more frequent than when we talked about 1 in a million. And almost any medicine that you give there's a 1 in a million chance of coming up with some kind of complication. The risk of not giving out the vaccine and causing death or severe illness is much worse than the risk of giving the vaccine and seeing those kind of complications. I don't want to downplay it, and I'm very proud that the CDC and the FDA acted when they did. I think that we're going to see them reverse their decision, and that's a real tribute to how the medical system in this country works. It's super careful, and they're always erring on the side of caution. So once that Johnson & Johnson dosing goes back into play, we're going to be pumping out a lot of vaccinations. And as of this week, I'm speaking to you on April 20th, the governor has allowed for universal eligibility. That means anyone who hasn't gotten the vaccination can get it. Doesn't matter if you have a pre-existing condition or you're not of a certain age. Anyone over the age of 16 can get the vaccination. And we just got other good news last week that Pfizer had completed a study that showed that giving the vaccine to people between the ages of 12 and 15 was safe. And we're waiting for further tests that will be done in children, parents who have voluntarily allowed their children to get it. The results of those tests will be out probably in the late fall, and I suspect that in the early part of 2022, we'll be able to start vaccinating children. But right now, anybody who wants it can get it. And that's sometimes a frustration because even when you were eligible as a 65-year-old or a 75-year-old, we realized that the system to get the vaccination was clunky. It broke down, the call-in number put you on hold for a long time, the computer didn't always register you right, and I know people were very frustrated by it. But we're urging everyone to be patient because everyone will have the vaccine available very soon. The CVS's of the world, the Walgreens, and the various supermarkets that have their own pharmacies are getting the vaccine now, and that will make it much more widely available. Now, why I wanted to appeal to you, I'm hoping most of the audience in the senior group has been vaccinated, and that's part of the reason that in this last little mini surge that we had a little mini surge going on right after Easter. I think it's leveled off, and I think it's probably going to die out, but we'll talk about variants in a minute. That's the only thing that makes me a little hesitant about guaranteeing that for you. But anyway, this last surge, we didn't see as many deaths or hospitalizations, and that's because you got vaccinated. You were our most vulnerable person to have gotten sick from this virus. And the vaccine helped keep that away. I can tell you at the hospital where almost 100% of the personnel is vaccinated, we haven't had nearly maybe 1 or 2 hospital workers a week getting sick. We used to, during the height of the second surge, which was around Christmas time, we were seeing 25 people a day in the hospitals getting sick. So the vaccine works. It definitely works. It might need a booster. Yes, it might need a booster. It might become like the flu shot, where every year you have to get another shot. But this is nothing compared to the joy we're all going to feel when we can start doing things again. And when is that going to be? Again, herd immunity. Herd immunity, where 80% of our population is vaccinated, we will be able to do a lot more things. Now, what's the threat to that? The virus, the longer it's out there in the community and the longer it's out there baking, it's trying to think of ways to kind of run around all of the vaccinations that we're doing. So they mutate. The virus is mutating into these different forms, which are called variants. There's a London variant right now that is the predominant variant here in Massachusetts. It started in the United Kingdom, and just when they thought they had everything locked down and it looked like they could open up again, they opened up, and this London variant showed up, and they had to lock things down again. There's another variant called the Brazil variant. There's another variant called the South African variant. There's a New York variant, and there's also a California variant. That's what viruses do. They don't want to die, so they don't want to get killed off by vaccination. They want to figure out a way to propagate, and that's what they're doing. If we don't get enough needles in arms, if we don't get enough people to be vaccinated in a timely way, like let's say between now and end of July, if we don't bang out enough vaccination to make 80% of the population immune, we are going to find vaccine variant will overcome us, and that's a threat. So where do you come in this? Most of you are vaccinated. I would bet most of you are vaccinated. Maybe 80–85% of you are vaccinated, which is wonderful. But your kids and your grandkids may have an attitude like, I'm not sure, I don't know if I want to. You know, I'm a young person. Everyone says it affects older people more. I'm not going to get that sick. Well, let me tell you what I'm worried about with that attitude. If a younger person gets COVID-19, it's true. They don't always get as sick as an elderly person would. But what happens to them is apparently the virus kind of lingers around in their system, and it turns on the patient's immune system. The system that is trying to fight off the virus gets turned on. Even after the virus is gone, if the younger person has fought it off, the immune system doesn't always turn off. And the immune system, if it's revved up, depending on what organ system it's in, it can cause damage. So we're starting to see a syndrome called long hauler syndrome. Long hauler syndrome means that certain areas of their body just are acting very strange. They have what's called COVID fog brain, where they're not remembering things. It's harder for them to do math. They don't seem to have the same grasp of problems that they did. There's people that have lung issues. Clearly, you know, that's the place where the virus gets into your body, and so it can leave you with a feeling of shortness of breath. People have had problems with their heart function, where they don't mount the same kind of response when they want to run or they want to, lift a weight or something like that. If they're athletes and they really do run, they've found that their legs are weaker. They also have lost, many of them permanently, or at least long-term, their sense of smell and taste, and their GI tract, where they're doing all their digestion, doesn't work right. So this is a real concern that so many people got COVID in the United States, so many millions of people, that we would find that this is going to be like our next big chronic illness, like Lyme's disease on steroids. An amazing amount of people could come in with a delayed presentation related to their COVID infection, which is why we never wanted to get herd immunity just from getting the disease. We wanted to get herd immunity from vaccinating against the disease. So why am I telling you all this? I'm telling you this because you are the elder of your family, and you have a lot of sway. And if you've been kind enough to go out for yourself, for your family, and for our community and get vaccinated, that's an example that we want you to set for your family. And if they're hesitant, If they're telling you, I don't really feel like I'm going to get that sick, tell them, no. You're going to do this not just for yourself, but for all the folks around you. Because you might not get that sick now, but you might get sick again in a year. You might not realize that a person that's not vaccinated can still spread the disease, and all of the vaccinations are not 100% effective. They're in the Moderna and Pfizer case, 95% effective. That means 5% of you can still get it. We also don't know, once you get the vaccination, if you couldn't be a silent spreader. So the best thing for everyone to do is get vaccinated. And you are trusted messengers within your family. So I am hoping and praying that we can use your wisdom and the respect that your family gives to you to influence them and say to them, get the vaccination. It's available for everyone now, no matter what age, down to age 16. Eventually, I think that 12 to 15-year-old group will be added in. And all of us need to do this for ourselves as a personal thing, for ourselves as a family member, for ourselves as a community member, and for the country as a whole. We want to be able to travel again. We want to be able to go to the beach again. We want to be able to go to theater or movies, enjoy dining, get married. The things that were part and parcel of our life here in the United States. And I know that a lot of you have been super diligent and have been amazingly compliant with all of the restrictions that we've had. All I can tell you is you will be rewarded, and we are recognizing your tremendous contribution to the community wellness, because we couldn't have done this without you. This was a huge collaboration between the medical centers and the community health centers and the city manager and the city parts of the government, the Department of Public Health. All of these elements went into play to try to minimize the disease in Worcester. And although about 420 of us here in Worcester lost our lives in the last year since the pandemic started, I think it could have been so much more. We had a very proactive government. We had a very proactive medical system. We took care of the convalescent COVID patient in the DCU center when other people didn't have such a place. We took care of elderly that needed to rest up and recover from their COVID infection at the Beaumont Center on Plantation Street when others didn't think of that solution. And we took care of the homeless in specialized homeless shelters that Dr. Castile stood up so that they would be protected from the virus, and we would be protected from them getting the virus when they were out and about doing their things in the city. So altogether, I think Worcester has acquitted itself really well, and now we're at the finish line. Some of you watch, I know, the press conferences that I do with the city manager and the mayor every week, and I always try to tell a little story. So I'm going to give you an inside track on the story I'm going to tell this Thursday. This Thursday is the 70th anniversary of General Douglas MacArthur, hero of World War II and Korea, going down the Canyon of Heroes in my hometown in New York City, getting ticker tape paraded, where all the people were hanging out the windows, giving him salutes for everything he had done for the country. Why was he getting this treatment in the middle of the Korean War? It was because he made one judgment that President Truman thought was a real threat to our safety, and that was he wanted to use the atomic bomb against communist China. That would have been a very, very dangerous decision. And I think the decision that Truman made, which was incredibly courageous because MacArthur was like a god, he just said, I can't afford having a nuclear war in Asia. So there was Douglas MacArthur, relieved of command, getting honored in New York City. Why am I telling you this story? He made a famous speech to Congress later that week. He went to Washington and he said, "Old soldiers never die, they just fade away." I love that quote. And it was a very sad moment for people that watched that speech because he knew that he had miscalculated and stayed too long at the parade, right? But I looked up some things when I was in Norfolk a couple of years ago. I have a dear friend who's a former resident of mine who's a pediatric surgeon down there, and she invited me to be a guest speaker, and the MacArthur Museum is there, and they have a lot of his quotes. And you know, he would look at this entire fight against the pandemic as a war, and you have to win the war. You can't do it part way. That was one of his strong beliefs. So he has this great quote that he says, "Aging will wrinkle your skin, but quitting will wrinkle your soul." So how about that for a message? I think that we cannot quit, because if we quit after we've come this far, if we give up on getting vaccinations, if we stop doing the 3 W's, if we give up on all of the restrictions that have kept us safe until everybody has this herd immunity, it'll wrinkle our souls. So I'm going to quit there, and thank you for listening. You have been the backbone of this city for many, many years. Try to talk your family into getting this vaccination for the good of everyone. And I'll see you next month.